Hello and welcome to another open day talk with the fabulous Michelle. This is part of the College of Functional Wellness talks that we're doing, and why I'm really excited about speaking to Michelle is that she is a specialist in women's health and particularly women's pelvic health. And so one of the conversations that we're going to have today is we're going to look at the structure, the physical side of female health and why it's so important. And we're going to be talking about things like backache and leg pain and how it's all connected, and this hormone profile. And so I'm really excited to be speaking to you. Welcome, Michelle. I thought we could start with you introducing yourself, what you do, what you're passionate about, what your business is.
Yeah, okay. So thank you so much for inviting me today to talk. My name is Michelle Norton-Hughes and I'm a women's pelvic health specialist physiotherapist. So I'm a chartered physiotherapist. So to give you a little bit of background as to how I got to where I am, as a student, I studied at university, did a 3-year degree course to become a chartered physio. And from there, I have worked my way through the NHS, through the military, through private practice. And I just noticed there was a bit of a passion for trying to really get to the source and the bottom of a problem. It's almost like you peel a layer of an onion, and each time you peel that layer, you want to find out what's underneath the next one. And it keeps going further and further along. And so I have always been really passionate about learning and developing my own skills. And having treated as a musculoskeletal physio, we are kind of experts dealing with muscles, bones, joints, skeletal systems, and thinking a lot in terms of functional movement, in terms of rehabilitation, strengthening, control. But the more you learn, the more you realize, the more you know, the more you realize you don't know. That great, wonderful saying. And I was treating my back pains, my pelvic pains or coccyx or hamstring tendinopathies. I had, world-class kind of athletes that were coming to me with recurring hamstring tendinopathies, and I had all the tools in the toolbox to treat a dodgy hamstring, so right up at the top of your leg. And I was kind of thinking, but I don't just want to treat it. You've seen lots of other therapists along the way. I want to get to a bit more of the source as to why you keep getting it, rather than just treating the symptoms of it. That led me a bit more into the pelvis and the pelvic area and thinking about the glutes control, which led me to go further deeper into the layer of the onion, which kind of got me into thinking a bit more about our pelvic floor muscles. And I realized that as a musculoskeletal physio, we don't naturally get trained in depth into the pelvic floor. So that's, and I'm thinking, but hold on, these are muscles, joints, ligaments, bones, they're all interconnected. Why, as their specialists, are we not considering this playing an impact in our glutes, which plays an impact in our hamstrings and our back pains? So this is where I've kind of developed my training, and I've gone on to register with POGP, which is the Pelvic Obstetric Gynae Physiotherapy Association, and done a few of their pelvic floor courses, as well as the Mummy MOT. And naturally have worked a lot more, having worked in all sorts with men, women, sport athletes. I've kind of like naturally progressed and now working a lot more with the woman, and thinking about pregnancy, postnatal, even into perimenopausal stages, and really trying to help the women who often come to me with a musculoskeletal complaint or a postnatal complaint, but I end up treating quite holistically to really get to the bottom as to how we can help them to. My business is called Rebuild and Thrive, and I've kind of adapted that a little bit more with my second business, which is now, thinking about how to get the women to heal their body, to rebuild it, and then to thrive within it. So that's me in a nutshell, really.
Oh, I love it. I love it. And what's exciting about this is we come from different training pathways and different views of pelvic health. But I think there's so many crossovers and so many things that and things that I know, that if we can bring it together in this talk, I think would be really, really interesting. So you mentioned, for example, the glutes. So as a kinesiologist, I did my training back in 2010, so I've been in clinical practice for over 10 years now, and I've been teaching kinesiology. And where kinesiology is, it just still blows my mind after all this time, is that it is the understanding that these muscles that you're talking about are actually connected into organs through the nervous system. So for example, you were talking about the glutes, which absolutely I see, because I also specialize in women's health. We do a lot with hormones and digestion, and it's what we see time and time again in our clinics. And the glutes are connected to the sex organs through the nervous system. And so what we see, there's it's not just the glutes, there's the gluteus maximus and the gluteus medius. So the medius is just like at the bottom of your back, and then the gluteus maximus is your big butt muscle. They are connected into the sex organs. So when we have compromised hormones, for example, so estrogen, progesterone, testosterone, or there is some kind of issue going on with the hormone system, then this can throw the glutes out. And so then when the glutes aren't working, I see things like neck pain. I don't know if you see this as well, is that if the glutes aren't firing, and the glutes offer such a support to the back and such a foundation to the pelvis, that when that posture goes out and the glutes kind of collapse, the back tightens, the neck tightens. And so people are coming in to see me and they're going, oh, like my back and my neck really hurt. And I'm going, but it's coming from your glutes. This is one of the reasons I love doing what we do, is that where the pain is actually is not where the problem tends to be. Do you find the same thing?
Yeah, so we would often say that it's where that you're either hinging or you're overcompensating and you're working too hard. So if you are compensating for an imbalance or a weakness somewhere else, you may then have something else may have to work harder to compensate for it. Or you might be hinging more on a particular area because of an instability above or below it. So I feel like I work with a bit more of a musculoskeletal, posture, strength, control kind of thinking a lot about more, doing a lot of medical background from, in thinking about evidence-based practice kind of exercises. And yet there is so much involved with energy systems. And I feel like actually we should work together with this as well, because it is, if there's two sort of schools of training, if you like, but actually if we can work out why then one area is so popular for one group of people and another area is so good for another group of people, and actually try and holistically talk to each other and go, okay, so we're both singing off the same hymn sheet, but we've just got a slightly different approach as to how we get there. So let's see if we can maybe combine our treatments to get the best for the patient. And every patient is going to have something slightly different that they need to work on. Every patient is an individual. And I just feel that there is so much that we can keep communicating and learn from the different professions as to why in that circle that is such a key area, and in our circle we might use slightly different language, we might have a slightly different way of anecdotally evidencing it or using randomized control trials or whatever it is, but ultimately we're trying to get to the same goal, and that is to, in our case, to help the women, to help them to have less pain, to be thriving in their own bodies and to feel the connection, and so that they can move as well and function as well as possible to thrive.
What do you see in your clinics time and time again when it comes to the pelvis?
So I get variety of things. So sometimes, because I'm dealing with majority of being, let's talk about my postnatal population a lot. So I am dealing with potentially people that have got pain or fear-based movement patterns. They might have scar tissue and adhesions from a C-section or an episiotomy or a tear, and this is affecting how their connective tissue and their fascia is moving, and they may find that they've got, as a result, issues with their bladder or their bowels. So they may get some stress urinary incontinence as a result of it. They perhaps are getting some issues with, you know, pain on sex or intimacy, or they may find that they're just not getting the same sensation that they used to get, or perhaps they've always had a problem. It's only because they're now postnatally that they feel like they got the confidence to talk about it and come and see somebody. But actually, if they're honest with themselves, you know, it was quite painful before, or it was tight, or it was weak, or they were leaking when they would cough or sneeze or jump, or they have got chronic constipation and IBS, which I know that, as you know, your background, you deal with a lot. But from my point of view, from a musculoskeletal point of view, this is really going to affect the pelvic organs and how we hold the pelvic floor. And you know, it could affect prolapse, it could affect pain. And so I deal a lot with that side of stuff, and I might even take that into stomach and abdominal separation through diastasis recti, the classic like mum's tum, if you like, and really trying to help educate women how that our system is all interlinked together, and how we need to, rather than punishing our bodies and thinking we've just got to get back to fitness in a quite a strengthening, you know, way, actually we need to love our bodies but understand them, so that we can really help to strengthen us from the inside out. And I suppose that's where the whole me specializing pelvis is come from. Really think about strengthening, and sometimes relaxing our pelvic organs, our abdominals, to improve the movement of our connective tissue, to improve our fascia, to improve our mobility of our joints, so that then when we've got the full range of movement and the full control, we can then work on the strengthening and so on and so forth. And I take kind of that approach. And I think sometimes where people go wrong is they go, I'm really weak, I've got to strengthen, I've got to strengthen, I've got to strengthen, I've got to strengthen. And you know how we described at the beginning how posture can mean that your glutes are weak, but you're focusing on strengthening, and then all of a sudden your neck and shoulders have overcompensated, and that's where you've got pain, because you've just been focusing on keep on strengthening, but haven't got to the real source of what was cool, what's being weak, and therefore going for the deep core.
I think one of the common things that I get is, so you talked about the mum tum, for example, and so a mum who is postnatal is, okay, she's identified that she's got this and she doesn't want it, so she's going, right, what I need to do is loads of sit-ups. And actually, from our perspective, from the kinesiology perspective, we muscle test. That's the core of our clinic, and it's not about the strength of the muscle, it's about the quality of the muscle, about what the muscle is meant to do. And so the muscles in our body, they're not meant to be strong and on all the time. When they are, that's where we get tension and where we get pain. That actually muscles are designed, when they're not doing anything, to be able to relax, and then when they are required, then they strengthen. And so it's this understanding of how muscles work together. So when we've got, in kinesiology, when we have a muscle that's not doing anything, because maybe, say for example, the glutes aren't doing anything because there's a hormone imbalance, so then the back is having to overcompensate, so the back really tightens, and it's the back is where we get the pain. Well, we need to look at, why aren't the glutes doing their job? How do we support them to start firing when they're asked, which then relaxes the back, because the back's not having to do all of the work. So it's this interplay between how muscles all work together, when they switch on, when they switch off, and what they're doing and why, rather than this, okay, what I need is strong muscles. It's about that understanding of how the body works together.
Yeah, I completely agree, and I often use the sort of analogy of your bicep curl. So if you imagine your pelvic floor it being like your bicep curl, and a lot of my patients are already starting in quite an inner range, so they're already quite tight and they're holding it on and they're gripping, but they've only got like this amount of range. So when they then are forced with a shopping bag full of shopping, whatever, to get into the full range, they're then really weak down here because they've been up here all the time. So then they're forced into this position down here, and they've not got the strength to bring it back up and control it. So this is where people can be actually quite strong and tight in a really inner range, but they haven't got the control and they're leaking, for example, but they are the gym bunnies. They physically look really, strong, but they're in a really inner range and they're not able to fully go through that full range of movement of that bicep curl to the full extension and then to the full flexion. They're just bam, 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 bam up here all the time. And so I just use that analogy to describe the muscle activation of the pelvic floor, and really that how important the relaxing phase is to then be able to draw all the way through up. So I suppose our way of describing muscle activation and actually getting the full range and control might be coming from slightly different backgrounds, but ultimately it is being able to fully relax it, getting fully out into the outer range, and then being able to fully bring it back up again, and being able to time that quickly when we need to. So jumping has got to be quicker, whereas more of a sustained hold on a bike, you don't have to be up here all the time, but you do have to have a level of control. And so you're maybe working on about a level 5, but then you're able to go in and out of it nice and well. Whereas, on the trampoline, we've got to be up.
Oh God, trampolines. So you've got this woman who's come into your clinic and she has these symptoms that you're talking about, that she doesn't have the flexion that she needs to have, and there's a lot of strength, but actually it's disguised as a weakness. Then what would you give? What kind, is it an education piece? Is it exercises? How do you work to be able to get that working again?
So it's a real combination of things. And I think our pelvic floor is a really emotional place where we hold a lot of tension, just like our shoulders are. And I think everything, and just like our shallow breathing is, all of these things are kind of interlinked. So the first thing that I do is I'm very aware that there is a little bit of a white coat syndrome sometimes when you come to see a healthcare professional, and particularly over something so intimate as our pelvic floor. So I'll listen to their story, I'll listen to their subjective history, find out exactly, what's gone on in the past, and try to help understand maybe some of the root causes as to what's going on and why we're having some problems. And then really put them at ease and use a lot of education in my discussions with them to help them to understand their own bodies. Then I will watch how they move, and I will see, if there's any obvious signs in terms of the way that they're moving, the disconnect in their body and in their movements. And this at the moment, first of all, is completely fully clothed, and I might take some postural photos and I'll show them and I give them some feedback and I'll say, can you see you're holding this shoulder up and you're dropping that hip, and it's a full musculoskeletal assessment like you would if you were seeing a musculoskeletal specialist. Then I will start to look at their breathing and their ribs and their stomach and assess their tummy gap. And I look at their integrity of their tissues in terms of how much bounce it's got back, but also how wide it is and whether there is sort of a disconnect in terms of I often call like a tummy gap, like a balloon being stretched. So when we go through pregnancy, the balloon is stretched, the fascia, the connective tissue is stretched, and everybody's balloon, starting and finishing, gets blown up to different sizes, is different integrities in the beginning in terms of their collagen buildup and the end. And so when we're looking at how they then, when the balloon is deflated, how it's sort of come back, it's not torn, it's not broken, but how stretched is it? So I'll look at that. I will look at their scar tissue if they've had a C-section and see how the adhesions of the scar tissue is. So physically getting my hands on whilst I watch to see how they move, but then I physically feel what's going on and I listen to the feedback that they've given me as well. And then I will do an internal examination with their consent. So I will try and make them feel super comfortable, because I know that as women, most of the time, the only time we have a medical examination like that is not for very nice things, is it? It's a smear test, it's something abnormal cells, it is a colorectal examination. None of these things are particularly nice, and a lot of them are quite fear-provoking, and so it's really important to make sure that the client feels super comfortable beforehand. and I explain exactly what's going on. I've got my pelvic models here, so I'll explain exactly what it is that I'm looking for, and I can talk them through it. And then I also have an internal one here. So when I'm doing an internal examination, we've got the rectum and the vaginal opening, and I'll explain to them, I am feeling for muscles, joints, ligaments, bones. I'm not a gynecologist. I'm not feeling for abnormal cells or any abnormalities like that. I'm looking to see how your muscle is, whether it's tight, whether it's trigger pointy, just like your shoulder might be, whether it's weak, whether it has got any signs of prolapse. And so I talk to them and describe, the signs of prolapse are, and I'll potentially have a feel through there for that. And then I help them to retrain their pelvic floor muscle. Because how many times do you go to the gym, for example, and you learn to do a squat, or you learn to do some movement exercises, and the personal trainer says, right, I'm just going to talk you through how to do your pelvic floor exercise, but I'm going to close my eyes, turn my back, so I can't actually see anything that you're doing, and hope you're getting it right, okay? Yeah, so you don't get any feedback, right? Because so many of us as women go, I think I'm doing my pelvic floor exercises. I mean, like I'm my eyebrows are going, and but we don't know. We don't know unless somebody really guides us and teaches us how to do it. And so I give people the feedback that they maybe think that they're doing it correctly, but actually they're pushing their bearing down, and all they're doing is they're creating loads of intra-abdominal pressure, and they're actually creating this tension through their stomach, and then that's causing a bearing down sensation of their pelvic floor. So they're actually having the opposite effect, rather than the drawing in and up that we're trying to get from them. So
I didn't realize you did all of this. This is amazing.
yeah, so I'll really do that internal and give you the feedback as to whether you're doing it right, because how many of us are like, I think I'm doing, I don't know. And then I'll help you to retrain to do that. And I suppose then, one of the really important things and factors that have an influence, and I think this is where I start to then refer on to other professionals, is, our diet affects our hydration, and our hydration affects the quality of the muscle tissue. If you look at a nice juicy steak compared to a beef jerky, it's a very different, the muscles function very differently. So if you're not hydrated well enough, your muscles aren't going to respond well enough to the muscle testing and all of the other work, and they might have more trigger points through them. So I give them some basic lifestyle advice, but then this might be then when I say, maybe we need to look at some of these issues. And perhaps, for example, bowel health and constipation. If somebody is chronically constipated, that is going to affect their pelvic health. So it may be that I'm the one that identifies that, and I might be able to do some fascial release, some abdominal massage work. We do it on our babies. We do I love you, ILU massages to help constipation on our babies, but we don't do it on ourselves. So I then might do some physical manual therapy to help to release that, give them some basic lifestyle advice in terms of trying to help them to get to the bottom of nutrition, and then refer them on to someone that specializes in that area. Or if I actually think there's a lot of emotional work going on that may be causing them to hold a lot of tension through their pelvic floor and have pain such as vulvodynia, so really hypersensitive pelvic pain, and that's a result of a heightened nervous system. I often find that I will treat that as I'm going, and then it may be that they may need to see a specialist in that area, a clinical psychologist, yourself, somebody that can talk them through some of the emotional stuff as well that's going on.
I really like that. That is something that is at the core of the training that we offer, is the understanding of what we as kinesiologists and health practitioners can offer, and when it is time to refer on. And that's why I love working as a community of practitioners, so that you have those, okay, right now, because the internal work that you do is we are not trained in that. And it's great to know that you do that, because I would absolutely refer my clients on to have that done, because it sounds so respectful what you do, and it sounds so important. So I understand the importance of muscles that aren't functioning properly or are too tight. And the way that I would work is, if someone came in with back pain or pelvic pain, I would be testing the muscles fully clothed in the clinic to find out which muscles are too tight, which muscles are unlocking. And then when I find which muscles are unlocking, then I also use, this is where my nutritional background and the nutritional side of kinesiology. So we work with bees, we work in 4 areas. We work structurally, nutritionally, emotionally, and electrically, like an acupuncturist, but we don't use needles. So we test the muscles to find the structure, and then to balance that pelvis, to balance those muscles, what we do is we identify nutrition. So for example, there are some key minerals such as magnesium, zinc, manganese, calcium, iron, you know, some of the big building blocks, as well as protein. I bang on about protein all the time because protein is in the body, it's a repairer. And if you've been through something big like childbirth or a C-section or some kind of surgery, then you're going to need to repair. And so having good quality protein as well as these minerals in the body. So what I can do is I can test different proteins, for example. I've got them in little vials in my clinic. I can also test these minerals and find out which mineral is going to switch this muscle on, which is going to really support this body. So, and then when I found that nutrition, then I start to work physically. So I have massage techniques, but I also have some, kinesiology was born out of chiropractic. So we have some kinesiology techniques. We work by manipulating the bowel. For example, we have something called an ileocecal valve correction, which when you look at what you were saying, if someone is chronically constipated, all of that like food waste in the bowel is going to be causing pressure on the pelvis and the uterus. So what we do is we correct the bowel, we correct the valves so we can get that constipation moving. I work dietary as well. So we want to make sure that there's no food intolerances going in and that the right food is going in. So, and like you said, hydration. Sometimes I think I could save you so much money if you just drank some water. I mean, it's really the basics. But getting that in, so that then the bowels start moving, and then we've got some structural techniques to get the bowel into the right place, to get the uterus into the right place, and to get all of the muscles around the pelvis switched on and working effectively. And then they go home and they eat the right foods and they take their supplements, which gives like this structure around the pelvis, which keeps it in place. Because I loved what you said about it's asking that question. Like us as practitioners, we can keep fixing, right? But why is it going out? Why is someone coming back in each month with that pelvis that is tilting? How do we get that pelvis to hold its own? And the other thing that we do is work emotionally. And again, I loved what you said about the pelvis being such like a seat of emotion. Like we as women go through so much in that area, sexually and childbirth and menopause and all of the stuff. So when there is a stuck emotion in that pelvis, I mean, it can throw the pelvis out, right?
Yeah, definitely. And I think there's a lot, you know, when you start working with emotions and energy and things like that, you know, there's a lot that we hold in our pelvis, a lot of, you know, trauma and fear-based things. And I think as a musculoskeletal specialist that we don't always naturally go to those things. We're almost sometimes treating the here and now, but to be really truly holistic and treat the patient, you know, we got to kind of not just identify what's wrong, but identify how we got there.
Yeah.
Because otherwise, if we don't do that, we might be the absolute experts in our field to know exactly, you know, what it is structurally which is not quite right, and what grade of a prolapse it is, and what level of muscle activation. Our grading system is slightly different to yours, but we could give all of these sort of medical terms to what we do, and which is so important and so valuable. But it's also thinking, how did we get there? Because we are not just a physical body, you know, there's a lot of things that affect us. You know, if you are cold, you hold your body differently. If you are happy, you hold your body differently. If you are, you know, and if you've gone through anything in the past, trauma-based particularly around the pelvic area, but sometimes it's not as obvious as things like sexual trauma. Sometimes it is just things that maybe are associated with IBS and, abdominal and chronic diseases and chronic fatigues and things like that that have caused our, there's a book actually that I'm in the midst of reading called The Body Keeps a Score. And I think that it's so true, your body holds a lot within it. And so we, working, with other practitioners that specialize in different things to really get the best for that client, for that woman, for that man. I mean, we're talking about women's pelvic health at the moment, but it's not exclusive. Men have pelvises as well. I do like to tell my male clients that, you got a pelvic floor, right? And he's like, what?
What do I do with that? So you treat men as well?
Yes, I do. Yeah. So I've come from a musculoskeletal background, treating, men in the military. I've worked at Chelsea Football Club working with men. I do more musculoskeletal physio with them. I don't do the internal examinations for a man at the moment. It's not something that I've specialised in, and I'm kind of going through the route of women and hormones, etc. as well. But I do treat men. I just don't do the internal stuff. So if I identify that I think a man actually has got his back pain, his chronic whatever, I can do the external advice for him. But then when it comes to that, so even things like erectile dysfunction, for example, in a man, there's a lot of emotional things that can go on with that, but there's also muscular functional things as well, and obstructive things. So then I would refer on to a men's pelvic health specialist physio to assess that.
Fascinating. One of the things that we work with the pelvis is there's a number of muscles that run through the legs that are connected to the adrenals to do with stress. So we've got the sartorius that runs through the front of the legs and into the inner knee. We got the gracilis, which is in the inner thigh. And what happens in our world is that when there is high stress, high adrenaline, high cortisol, and those muscles switch themselves off or get too tight, it can go either way with a pelvis, is that stops holding the stability of the pelvis. And what we see is that maybe one side will go off and we'll get a pelvic rotation. And what's interesting is that when that happens, we talked about the valves in the bowel, for example, like that ileocecal valve, which is in between your belly button and your right hip bone. When your pelvis twists, that ileocecal valve then gets stuck, either closed or open, because it has this kind of effect when it's working. But when the pelvis is twisted, then that valve can't work effectively. And often we find that this is why we see digestion as being such a victim to stress hormones. Do you get the same when someone comes into your clinic and you go, oh my God, okay, right, this is stress. We've got to be looking at stress, because you can see that the stress is causing the structural changes to happen?
Yeah, definitely. I'm definitely finding that my practice is changing. It's constantly evolving. And certainly there's been a big shift in the way that I am treating my clients in the last few years. And I'm noticing, whereas I would have ordinarily looked at that twist and or something like that, and very much stayed on the musculoskeletal path of, oh, well, this is weak, so you need to do your glute strengthening here, or you need to do your stretching of your hip flexor here. I will still do that, but I will couple it with, actually, you're really holding yourself, got a lot of tension, and I'm a bit more subtle about it in my practice. I think, it's much more about, making them feel comfortable and encouraging them to talk through my session if that's what they need to get anything off their chest. And, sometimes my clients go, I feel like I've had a counseling session. And I'm like, well, we've also done some strengthening, and then we've done some release work. And because it one thing isn't in isolation. Stress and the way you hold your body, like you've just described, I didn't know all of these things. The way that you hold your body is linked with the way that then you move, and then what gets more strong, what gets more weak, and then in your case, what you were just saying about how that then links to a physiological effect on our valves, as well as then an absorbing effect, in terms of our nutrition. But it also has an effect of then the choices, the lifestyle choices that we make. when we're not in a good place. So, we
Definitely.
make, when we start going down the slippery slope, we make different choices. And so I think it's really interesting what you were saying. And I think that definitely working with people's emotions, and I think that studying the pelvis and the pelvic floor more, going down the route of how women, and finding that my female clients may present pretty straightforward, but the more you peel back those layers of the onion, the more you realize that there is so much more involved in our bodies. And actually to really do the best job by that client is to really ensure that we're treating the whole of them.
Yeah.
So,
Oh, absolutely. We've got this, it's one of the original kinesiology techniques. It's called spondylogenic reflex, and it's to do with the tension in the diaphragm. And I think physios work with the diaphragm as a stress structure in the body. Like this area can be so important. And so what we do is we apply pressure into the navel and into the diaphragm with the breath. And so the client sort of takes a deep breath in, and then we apply this pressure into those two areas. And 9 times out of 10, if that is tight, if that is testing as a priority for me to be able to balance in my clinic, there is some kind of emotional connection going on there. There is something where, like with the diaphragm, that holding of the breath, that trying to control what's going on in our lives, creates this tension that makes us such a rigid. You can feel it when I'm actually working with it in the clinic, and I'm getting them to breathe into this place that they probably haven't breathed into for quite a long time, that the flood of emotion that comes through, I always say to my clients, this can be quite an emotional technique. While we're doing it, if you feel the tears coming, if you feel the anger coming, just roll with it, see if you can let it go, because my experience is that when they're able to have that emotional release and they're then able to breathe into the diaphragm effectively, it's a game changer. They feel so different. And it's something that I love, is that when clients leave my clinic, they look different. They feel like they have shifted something, that something has gone back into place, or something is balanced. And that is something that one of the reasons I love doing what I do.
yeah, so we work a lot with the breath as well, and thinking about the synthetic and parasympathetic nervous system, and actually how it affects the calming effect of that as well. And when we're talking, I've said about musculoskeletal system, but it's a neuromusculoskeletal system that actually, as a physio, we specialize in, and the connection of our nervous system on our muscles and our joints. And so the breath has been proven to be a really positive and effective way to calm our nervous system. Our nervous system supplies our muscles. And so it's actually thinking about how can we try and calm that nervous system to then stop the overactivity and the overfiring of, say, our diaphragm, so that we can actually get the full, if you like that bicep curl again, it's just so much easier to demonstrate this on Zoom, but that full relax and activation, of all of our muscles, but particularly our diaphragm. And so from an anatomical point of view, yes, during pregnancy, everything has been physiologically squashed up there, and we've therefore had more shallow breathing. But it may be, so I would go in, and some of the techniques might be, we would use things like muscle energy techniques, mobilization with movement, some manipulations, and then some massage, fascia, connective tissue release. And so I would still work with the diaphragm, get them to take their deep breaths, and maybe do some hold, relax, or some gentle release work through there as they are, to try and help them to improve the function of their thoracic cage, their lungs, their mobility through there, which in turn has a direct effect on the connective tissue and the fascia, and how our abdominals therefore work, and how our pelvic floor therefore works. So I kind of like to describe it as like, You've got your sort of shoulders that potentially hold a lot of tension and can come up. You've got your diaphragm and the shallow breathing that can add to that, and then you've got the tension through your pelvic floor that can add to that. So everything can just be really sort of tight and drawn up, and so it's trying to literally all the way down from shoulders, like nervous system, down through to the diaphragm, through the abdominals and the pelvic floor.
Yeah, I absolutely agree. And one of the things that we work with, this understanding of the sympathetic and the parasympathetic nervous system. So this stress and this rest and digest, and the rest and digest parasympathetic nervous system. We also look at things like the vagus nerve, which is a really important connection between the digestion and the nervous system. And so when we're able to breathe, when we're able to rest, when we're able to switch off, then that connection between the digestion, the vagus nerve, and the nervous system, we're able to digest our food. So this is why I see so much IBS, and it's why I think IBS can be really misunderstood as a condition, that we see so much IBS is coming from this high stress lifestyle that we are leading, where we're not giving ourselves some time to take some time off.
Yeah, IBS is so coupled, and I would have never said that was an area of speciality as a physio. It's not, but it's so, the more I see from a physio's point of view, from pelvic health, from back pain, from, anecdotally, you ask them, there's often a link. There is so often a link, and stress through our bodies, and the more you ask, the more you realize actually that's so connected with their pelvic pain, or with their, and then you can think about it anatomically, like I described, because if our bowels are constantly full, they are pushing into our pelvic area, so chronic constipation has that effect, but it also has a tension holding effect as well, and then an increased sensitivity of our nervous system that then can have a pain effect. So these things are so interlinked. I just think it's fascinating. We could
It's a rabbit hole, isn't it?
It is a rabbit hole, and there's
never
a place,
come out.
Yeah, and there is a place for everybody, and there's a place for different professions, and I just feel that it's really important to learn from each other, so that we can best treat our clients better, and also to know when your limitations of your own practices, and when it is important to look for other experts to refer on to.
Totally. What would you say are the 3 take homes for a woman who is having any kind of pelvic health issues? What are the 3 things she needs to think about or do?
Oh wow, okay. I really do believe that that we need to understand our bodies better, and so doing things like talks like this to sort of understand the connection of our bodies, is really important. I would highly recommend going to see a women's pelvic health physiotherapist. I still see one myself on a regular basis, and I do it a little bit more for wellness checkups as well. I learned so much about my body and where I hold the tension, and when I can feel things coming on and I can release it and strengthen, things like incontinence postnatally, or pelvic pain, or not having comfortable sex or thing, is common, but it is not normal. Not having, even if we go down thinking about sexual pleasure, it is an organ of musculoskeletal nervous system, and it should be functioning correctly, and if it's not, it is normal, but it is not common. So my first thing would be to educate yourself as much as you can, to understand your own body and how it is all connected. Go and see a specialist. I would recommend, if it's really specific to pelvic area that you're getting problems, whether that is pain, incontinence, scar tissue adhesions, anything like that, go and see a women's health pelvic health specialist. I can't think of a third one. I think I've said too many.
I think that's great advice, and I would say the same. I think that because I'm the same. Like, I see practitioners, when things go out in my body, I go, I need to be on a couch with someone who knows what they're doing, who's going to be able to put this back into place. I think taking control of our own health is so important, and I don't think we're massively taught it in our culture. So I think it's something that is starting to change.
Yeah, I do think it's something to change. I think as well, sorry to interrupt, I think that we've been a bit more of a reactive culture rather than a proactive one. And I think that the healthcare system in the UK is fantastic, for dealing with emergencies like, pandemics, or dealing with the fact that if you have a car accident, you want to be going to intensive care. Like, thank goodness there is that service available. We've got an A&E. We have got, if you break your leg, you're going to have a top orthopedic surgeon treating it, etc. But perhaps what we could help the system to do is to reduce the chronic illnesses that derive as a result of lifestyle. So, chronic pelvic pain, unless there is a medical anatomical dysfunction or a genetic something, like a lot of the time it is a result of our wellness and our lifestyle. So actually taking a little bit more control and seeing health and wellness as a little bit like an MOT for your car. You don't just buy your car and then think it's going to last for 30 years. You have to keep servicing it and MOTing it. And even when it's not broken, you still take it for a service and an MOT, and then they pick up little things, they tweak it, they improve the health of it. They therefore improve how it runs, how efficient it is, and how it lasts. I really see our bodies and our wellness as being part of that. And I think that we just can change our mindset as to healthcare, and to stop coming when we're already broken, and start to look after our wellness to prolong the life of us and how we function to get the best out of us, really.
Yeah, especially, like, I'm heading towards like vintage car territory, so I kind of need to go to like a vintage garage and start looking after these bits and pieces that like, being in my 40s is such a different experience to being in my 30s, and I want to make sure that things stay intact. I think that's great advice. If someone is looking for more support from you, I know that you've got your clinical practice, but you also offer this gorgeous, for postnatal mothers, I believe, called Fly Mama. Do you want to say a little bit about how to find out about how to reach you and to get your services?
Yeah, so Fly Mama stands for First Love Yourself Mama. It was founded by myself, a women's health physio, but also by my business partner and very good friend, Kelly, who is a yoga instructor and trauma specialist, I guess, that deals a lot with matrescence, which is the word that describes the transition that a mother goes through when they become a mother, when a woman goes through when they become a mother. And it's that whole social, economical, mental, where are you in society, that identity. So we know that in order to heal a mother physically, we have to also think about healing them and supporting them emotionally as well. So it is a platform where we do have physical classes, we have yoga and Pilates classes, and we take people through the physical stages of growing their bump, healing in their fourth trimester, restoring their energy, no matter how far down the line in pregnancy, postnatal journey you are. As mums, whether we've got a 10-year-old or a 2-year-old, we're going to have times in our hormonal cycle even where we need a little bit of our rest and restorative practice. Then we help you to rebuild your strength, but to rebuild it from the inside out. So I talk a lot about how to correctly activate your pelvic floor, and I give you cues as to how to safely engage your core, so that it's not about doing 100 sit-ups, it's about adapting them so that we are making ourselves better, not worse. So that then we can then thrive in our later classes, which are the physical impact classes. So this is getting you back to do whatever it is you want to do, whether that's running, whether that's jumping, whether that's Paralympic weightlifting, or whatever it is. It can be anything. We're inclusive of all mums. but that's our physical journey. But then coupled with that is also the fact that we're also going through an emotional one as well. So we have guest speakers on our platform. We have clinical psychologists. You've come and spoken to us as well about the diet and nutritional side of things. And I think it's really important to treat a mother holistically. So at the moment, it's an online platform that is a monthly subscription. And it's a case of come and join us live for classes, watch anything back. All of our classes are stored on our platform so that you can watch them back. It does include educational sessions. It includes matrescence coaching with Kelly. You know, it's a really lovely community. And it was, Kelly and I have both got toddlers, and it was founded as we were going through our motherhood journey, and we were realizing that there is a lot out there that's talking about getting your body back and getting this back, but there's not something that's out there that's actually thinking about the physical and mental wellness of a mother, and how to optimize getting your body back is not just about beasting yourself, it's about the whole experience. But don't get me wrong, I do love a good sweat as well, so we do that as well.
That's amazing. Thank you so much, Michelle. I mean, we could talk about pelvises all day long, but and I hope that we can do another one of these, because I'm so interested in the way that you see the body and how you work with the body and how the overlap happens and what the differences are. So thank you so much, and I will see you soon.
I will send you some links to my website and Fly Mama as well, so that if anybody does want to get in touch, I'll give you the details to pop on. So thank you very much for inviting me.
Thank you, Michelle. See you soon.
Bye, everybody. Thank you.
Bye.